Welcome to the overview of the Manual of Standards and Guidelines on the Management of the Hospital Emergency Department, Second Edition. This video was developed by the Policy Planning and Program Development Division of the Health Facility Development Bureau. This video includes the following. First, an introduction to the Health Facility Development Bureau. Next, an overview of the Manual of Standards and Guidelines on the Management of the Hospital Emergency Department, Second Edition, and a brief description of their chapters. Let's start with the introduction to the Health Facility Development Bureau. The Health Facility Development Bureau, or the HFDB, is under the Department of Health, Health Facilities and Infrastructure Development Team, or the HFIDT, which is led by Undersecretary Lilibeth David. The HFDB, headed by Director Maria Teresa Vera, has an administrative unit and three functional divisions, namely the Policy Planning and Program Development Division, the Health Systems Development and Management Support Division, and the Facility Performance and Management Division. The HFDB has the following mandates. First, we develop plans, policies, programs, and strategies on health facility development, planning, operation, and management. Second, we provide coordination, technical assistance, capacity building, consulting and advisory services related to health facility development planning, operation, and management. And third, we advise the Secretary and the Undersecretary of Health on matters pertaining to health facility development, planning, operation, and management. Among the programs of HFDB are the Integrated Hospital Operations and Management Program, or IHOMP, and the Continuous Quality Improvement Program, also known as CQI. In particular, the IHOMP is a set of guidelines which aims to improve efficiency and effectiveness of healthcare services through the creation and use of information for clinical, administrative, and monitoring purposes. On the other hand, CQI is a performance management arm of the National Quality Framework in Health. Both of these programs ensure that all consumers receive the highest quality and cost-effective health services through the development and maintenance of a qualified, diverse, and accessible multidisciplinary network of care and service organizations. The Manual of Standards and Guidelines on the Management of the Hospital Emergency Department was developed under the umbrella program of the Integrated Hospital Operations Management Program, or IHOMP, which is under the Administrative Order 2022-0021. The manual also incorporates essential emergency department specific content on continuous quality improvement under AO number 2020-0034. In this section, the chapters of the Manual of Standards and Guidelines on the Management of the Hospital Emergency Department, Second Edition, will be discussed. From here onwards, the above-mentioned manual will be referred to as the ED Manual. This slide shows the 10 chapters of the ED Manual. The first chapter is the introduction. Here, the emergency care as a human right is discussed, as well as the legal framework related to emergency care and emergency care systems framework. In this chapter, the emergency department or unit as a structure is defined as well as the scope of the particular manual. Chapter 2, Emergency Department Services. In this chapter, the emergency department patient is discussed, as well as the care and interventions that can be provided by the emergency department. The resource stratified framework of emergency and acute care services and an overview of the other services provided in the emergency department are also discussed. Chapter 3, Governance and Leadership and Management. In this chapter, a general overview of the leadership and management of the emergency department is discussed. This includes the organizational structure and roles and responsibilities and qualifications of staff in the department. Chapter 4, Infrastructure Standards. In this chapter, information on the design considerations specific to the emergency department and its services are provided. This includes space planning and design considerations for special services and ancillary services in the department. Chapter 5, Medicines and Supplies. In this chapter, the list of medications and supplies needed across levels 1 to 3 hospitals are listed. Among them, those mandated by Philippine law to be available in emergency departments are indicated as well. In addition, medication standards in the emergency department are also discussed to ensure that medication safety is upheld. Chapter 6, Systems and Procedures. This chapter presents standards of care that promote institutionalization of patient safety practices through systems and procedures. These include standardized definitions, overview of patient flow, triage systems, and guidelines on specific patient needs. This chapter also includes standard procedures for referral and handover, intra-hospital transfer of critically ill patients, guidelines on disposition of patients, cadavers, and dismembered body parts, as well as special ED principles, special populations in the ED, and ethics in the ED. Chapter 7, Guide on Special Situations. This brings into context the various special situations that occur in an emergency department, which includes matters handled by the Women and Child Protection Unit, mass casualty incidents, emerging and re-emerging infectious diseases, surge capacity, medical examinations of apprehended persons, and management of aggressive or combative patients. Chapter 8, Ancillary Services and Clinical Support of the ED. Here, recommended clinical support and ancillary services are provided depending on the level of the hospital. A brief description of expected services from the satellite pharmacy, clinical laboratory, diagnostic radiology, and other clinical support units, such as operating rooms, ED access to special care units, poison control or information unit, and custodial services are outlined in this chapter. Chapter 9, Medico-legal cases in the emergency department. In this chapter, medico-legal cases are defined, as well as the policies and mandates related to these cases. Other aspects of medico-legal cases are also discussed, such as health information management, consent for examination, and guidelines on documentation and reporting, managing evidence, poisoning, and medical negligence and reckless imprudence. And lastly, Chapter 10, Continuous Quality Improvement in the Emergency Department. In this chapter, the general principles of CQI are discussed. Tools and strategies on CQI and its ED implementation are provided. Recommended quality metrics and indicators are also defined for use of emergency departments nationwide. The ED manual was disseminated through Department Circular Number 2022-0227. A digital copy of the manual may be accessed through the link provided. Before I end this presentation, let me share the other programs lodged under HFDB. These are the systems, programs, projects, and databases currently being handled by the HFDB. For more information, you may contact us at the following: Maraming salamat po.